a parent caring for a child, and just note the moment that we're in right now in day 29 of a shutdown. And I thought you, Dr. Ramachandran, really helped bring out that the numbers of people that we're talking about who won't be able to afford their health insurance, and when they shop on Saturday, or when the opening period of shopping for Affordable Care Act marketplace plans, they're going to have a real shock.
I defer to Senator Baldwin.
Thank you, Mr. Chairman. I want to take the thread of what Senator Kim was just saying about the urgency of a parent caring for a child, and just note the moment that we're in right now in day 29 of a shutdown. And I thought you, Dr. Ramachandran, really helped bring out that the numbers of people that we're talking about who won't be able to afford their health insurance, and when they shop on Saturday, or when the opening period of shopping for Affordable Care Act marketplace plans, they're going to have a real shock. And I worry on both sides. I so support the biotechnology innovation that's going on across the country in my state. I want to talk about that with you, Mr. Crowley, in a moment. But we have an opportunity here to act, to bring some relief so that parents can afford to get health care for themselves and their children. And I just wanted to emphasize that. Now, to the topic of today's hearing, Wisconsin is a national leader in biohealth, thanks to our investment in strong research institutions, advanced manufacturing, workforce training, and industry partnerships. According to the 2024 Wisconsin Biohealth Economic Impact Report, the industry supports about 141,000 jobs and generates over $37 billion in total annual economic impact. And because of the strong foundation in my state, in 2023, a consortium led by BioForward, a member of Bio, was selected as a regional tech hub focusing on personalized medicine and advancing the adoption of the next generation of theranostics. Mr. Crowley, in your testimony, you mentioned that each part of the biotech ecosystem is integrated and complex. And so I wonder if you could speak to the importance of funding programs like Wisconsin's Biotech Hub, that deals with all of the ecosystem parts.
It does. Thank you, Senator. Again, Wisconsin is one of our great states in biomedical research, as you indicated, anchored in great academic institutions and entrepreneurial mindset. So I think it's a great example for the United States and many of our other states as well. When it comes to funding, these state-funded programs that oftentimes complement private capital, also oftentimes complement federal capital, are incredibly important. When you're starting a company, it's a very risky environment, and capital markets wax and wane. So oftentimes these state funds can provide the capital where there's either failures in the capital market or the technology is simply too early. And if you look at Wisconsin, some of the therapeutic areas that you alluded to that they're developing are areas where they have expertise coming out. And that's one of the things you see with many states. Not everybody's trying to do everything. Some are experts in cell and gene therapy, again, coming from their entrepreneurial base, coming from their academic institutions. So yes, I think these are incredibly important programs and a part of the ecosystem, but important to recognize the vast majority of capital that goes into drug development is private capital.
Yeah. In April of this year, and you referenced this report, Mr. Crowley, the National Security Commission on Emerging Biotechnology released an action plan with a number of recommendations regarding the future of the field. And the report aims to ensure that the United States remains the global leader. We've seen this playbook before with China. They make a sector a strategic priority, and it can achieve global dominance in that space if left unchecked. We cannot let that happen with biotechnology, which is so critical to our public health and economic strength and national security, and for the moms and dads with children that they love so much. So can you expand upon the dangers of losing our global leadership within role within biotechnology? And what would a world where China leads in biotechnology look like?
I think it would be a very different world from the one we have today for the health and safety of our entire population. We need access to our medicine, so we need to think about where are they made. At the end of the day, Senator, I don't care where my kids or grandkids' toys are made. I really care where our medicines are made. So we need to act with great urgency, as Senator Kim said, to look at biomanufacturing. Where are we making our medicines? How are they distributed? And ultimately, where is the research and development coming from? So this is incredibly important. We must win in biotechnology. We have the lead today. If we don't continue to act, it'll be a very different world.
Thank you.
Thank you, Mr. Chair. Great witnesses, great panel. A lot of agreement around this life cycle of innovation, beginning with research through the NIH and our research institutions, on to improvements in the validation and approval process, onto strategies that can increase production, especially production here at home. So I appreciate this. I'm very proud to represent Virginia, which is a leader in biotech research and innovation. When I was a city councilman and mayor, I helped found and then grow the Virginia Biotech Research Partnership Authority, which has grown investment and interest in biotech in Virginia and the Richmond region. This continued investment has done very well for the Richmond region where I live, but across the state. The Richmond-Petersburg region received an advanced pharmaceutical manufacturing grant through the first an ETA Tech Hub designation through the CHIPS Act, but also $52 million for advanced pharmaceutical manufacturing through the American Rescue Plan. And that has really enabled the Virginia biotech industry to take off. Just in the last few months, we've been benefited by announcements for several major projects in Virginia. AstraZeneca, Eli Lilly, and Merck are making massive investments, but our ecosystem also includes small innovators that are doing great. We're celebrating the 20th anniversary of the Genelia Farm campus of the Howard Hughes Medical Research Institute in Loudoun this month. So there's a lot going on in Virginia. I wanted to ask about one part of this innovation chain. So beginning with research through approvals and innovation through production. In the 1980s, there was a set of lawsuits filed against vaccine manufacturers over the DPT vaccine, diphtheria, pertussin, tetanus. And those lawsuits threatened to shut down the manufacture of those vaccines in the United States. And so Congress created the let's see here, the Vaccine Injury Compensation Program, which has been a substitute for the traditional tort system and created a no-fault mechanism for those who do suffer side effects from vaccines to receive compensation. By my way of thinking, that's worked pretty well. It has not only worked well to provide prompt recompense to those who do have side effects, it's also done pretty well in enabling us to collect data so we can see how many successful claims per million vaccines there are in DPT and in measles and in COVID. And tracking that data turns out to be really helpful to us as well. I'm very worried that Secretary Kennedy has flirted with the idea of eliminating the program and restoring us to the status quo ante from the 1980s, where it's just like a litigation free-for-all against vaccine manufacturers. And I worry if we went back to that, we would see the same that we were seeing in the 1980s, vaccine manufacturers saying it's just not worth doing it. And then we would lose the ability to actually produce these vaccines here at home. I appreciate that there's uniform acceptance and support for vaccines, safe, reliable vaccines on this panel. How damaging would it be to the production of safe, reliable vaccines here on our home shores if we were to eliminate this vaccine injury compensation program? Dr. Ramachandran, I'll start with you.
it would be disastrous. In particular, manufacturers are very sensitive to what, the government is asking for, right? What the regulations are. And so the market is really dictated in many ways, as many of us have talked about, by how government sets policies. And so the Vaccine Injury Compensation Program has provided that sort of security blanket for manufacturers to be able to safely proceed. If they anticipate any sort of disruptions to the market, either because of removal of the program, changes, to recommendations, changes to coverage in particular as well, they will exit the market. And so we're seeing right now across different states some efforts from manufacturers to say, can you make sure that we can still have a place to be able to provide vaccines for your constituents? But at a federal level, that has a much more broad impact and does not provide them security. And for patients, ultimately, that means they won't have access to the vaccines that they need, and we will have too few choices to offer them, and the possibility of infections that we thought were gone coming back again, potentially.